Hi, I'm Katarina, and I'm a graphic designer. I was recently diagnosed with bipolar disorder. I get really depressed, and other times I will get really excited about something or really irritable. You're okay, and things are gonna be rough sometimes, or we go in cycles, and it's about finding the right help. I was recently hospitalized for being, psychotic and delusional, and what that means is that I lost touch with reality, and so the most important thing for me is to accept help and trust people, because sometimes they have a greater sense of what's real than I do at a certain time, and it's hard to be wrong when it feels right. And it's the scary part of the illness, is that sometimes everything's going to be fine, and that's good, but sometimes things are not going to be fine, and not going to realize it. So just hang in there, and it'll pass. Sometimes it's important to sleep through it, and sometimes it's important to journal, write down stuff, and find reasons to be happy. All right? Hang in there and trust yourself, because no one else is going to live your life but you. It was hard because I could rationalize it all I wanted, but still I had this feeling in my body like I couldn't relax. And that passed. Being hospitalized sucked, but it was really important for me to go through. It's a great place to realize how serious mental illness can be. So if you're there in the psych ward, I know what that feels like, and there are many characters you will meet in life, but none quite so colorful as those in the psych ward, because they are there for very different reasons, and sometimes similar to yours and sometimes not. And it's important to be able to respect them and their healing process, and for you to learn about you and your healing process. What people always told me, and what I'm going to tell you, is that we're all different, and what works for me might not work for you. And so I can only tell you what works for me. And one of those things was realizing that I had a problem, and then taking the medication. Trying it is really important, because you might feel a lot better once you have it, and that's great, because at the end of the day, it's whatever helps. Therapy helped. I really enjoyed talking to a person who knew what I was going through and was able to rationally take what I was saying and put it into terms that I could understand. And it felt really good not to be alone in this, and it's a big one, is that you're not alone, and it happens to everybody at different times in their life. They're shocked and scared and have to think about themselves differently, at least for a while. And it's kind of an obsession that fades over time. And so I used to Google bipolar and symptoms of mania and psychosis and the different drugs and side effects, and I would just do that all day and look at all these different experiences. But I wasn't living and just going out there and giving my best shot at doing what I've kind of always done, which is just relax and see how we can better ourselves. So I want you to just take a deep breath and focus on how you want to live. All right? Take care.